All right, welcome. In this quick reference explainer, we are breaking down everything you need to know about crutch walking, whether it's for your exams or for your clinical practice. Okay, let's dive right into it.
It's a really critical question because, honestly, getting this wrong can have some pretty major consequences for our patients. So let's start with the absolute foundation, getting the fit and safety right from the very beginning.
Before your patient even thinks about taking a single step, there are two numbers you have to get right. These are absolutely non-negotiable for preventing injury and making sure they're stable.
First up is 2 to 3 finger widths. This is all about the clearance you need between the patient's armpit, their axilla, and the top pad of the crutch. And this tiny little gap, it is the absolute key to preventing a really serious complication.
And here's our second magic number, 20 to 30 degrees. This is the angle you're looking for at the elbow when the patient is holding the hand grips. Getting this angle just right makes sure the patient's weight is right where it should be, on their arms and hands and not their armpits.
Right. So what does that mean? Well, here's the bottom line. If a patient leans their body weight on those axillary pads, they are seriously risking damage to this nerve. And that is exactly why getting the fit right and educating your patient is so important.
You've got to hammer these points home with your patients, constantly. Weight on the hands, not the axilla. Okay, so now that we've got that safety foundation locked in, let's see how this all builds into the different ways of walking.
Okay, now for the main event, the gaits themselves. And look, don't try to just memorize 5 separate things. It's much easier if you think of them as points along a spectrum.
And this really gets to the heart of it. This is the fundamental trade-off you're always making when you choose a gait. You're always trading stability for speed. There's just no way around it. The more stable and safe a gait is, you guessed it, the slower it's going to be. Okay, this chart right here, this is your new best friend, your go-to reference. It breaks everything down perfectly. Just look at the ends of the spectrum, right? You've got the 4-point gait, super slow but maximum stability, perfect for someone with severe weakness. Then all the way at the other end, you have the swing-through. It's the fastest by far, but you need some serious strength and balance for that one.
All right, so let's actually break down the mechanics. How do these gaits work, step by step? We'll start with the most stable one and work our way up to the fastest and most dynamic.
So first up, the 4-point gait. This is a very slow, very deliberate sequence. It goes right crutch, then left foot, then left crutch, then right foot. What's the key here? You've always got 3 points of contact on the ground. That makes it incredibly stable, which is why it's the go-to for patients who have pretty significant weakness in both legs.
Okay, so moving up the spectrum, we have the 2-point gait. Think of this as the next step up from the 4-point. Instead of 4 separate movements, we're now combining them into just 2. So it's the right crutch and the left foot together, then the left crutch and the right foot together. It mimics a much more natural walking rhythm, but yeah, it's going to take a little more balance and coordination.
Now, the 3-point gait. This is probably the one you're going to see most often, especially for something like a simple fracture, where a patient absolutely cannot put any weight on one leg. The pattern's pretty simple. You move both crutches and the injured leg all at once, kind of like a tripod. Then you swing your good leg forward to meet them.
All right, now let's compare the swing to versus the swing through. The absolute key difference here is where the patient's feet land. The swing to is the more cautious move. The patient swings their legs forward, but lands at the level of the crutches. Think of it as the safer bet for someone who maybe doesn't have the strength or the confidence for that bigger movement yet. They're landing safely inside their base of support. And now for the speed demon of crutch gaits, the swing through. So how does it work? First, you put your weight on your good leg or legs. Then you advance both crutches forward. Next, you transfer all that weight onto your hands and crutches. And then, this is the big part, you swing both legs forward, landing past the point where your crutches are. This one takes some serious upper body strength, no joke. It's for your experienced users who are strong and really confident.
Okay, here's a special case you absolutely have to know for your exams. What if your patient has really bad arthritis in their hands or just a very weak grip? Well, a standard crutch is a no-go. They just can't bear weight through their hands. So they're going to need a platform crutch, where their forearm can rest on that platform and take the load. All right, let's talk about stairs. This can be one of the scariest things for a patient on crutches. But thankfully, there's a super simple mnemonic that makes teaching this basically foolproof.
So, when you're going up, just remember this phrase, up with the good. The strong, unaffected leg moves first. Why? Because that allows the powerful muscles in that good leg to do the heavy lifting and pull the rest of the body up to the next step.
And for going down, it's the opposite. Down with the bad. This time, the crutches and the weaker, affected leg move down first. This is all about safety. The strong leg stays up high to control the descent and keep things nice and stable.
Okay, so you've done the hard part. You've fitted the crutches perfectly, you've taught the right gait. Now what? You're either handing off to another nurse or getting the patient ready for discharge. What are the absolute must-knows you need to pass on?
Just think of what's on this next slide as your final safety checklist. This is what you need to cover to make sure your patient is going to be safe when they're on their own.
These right here are the non-negotiables. You have to tell them to check the rubber tips on their crutches, make sure they're not worn out. At home, get rid of all those loose rugs and clear a path. Obviously, watch out for wet floors. And here it is again, the big one. Always put weight on the hands, not the armpits. And really emphasize this last one. If they feel any numbness or tingling in their arms, they need to report it immediately. That is a huge red flag for nerve compression.
So it all comes down to this, right? If your patient is walking out the door, what is the one single thing you absolutely cannot let them leave without understanding? Honestly, after everything we've talked about, it has to be this. Put your weight on your hands, not your armpits. That single instruction could save them from a serious long-term injury. Thanks so much for tuning into this quick guide.